Today we're doing intramuscular injection and subcutaneous injection. For both of these, you need to adhere by the 12 safety practices, which include verifying your physician's order. You would need to consult your manufacturer's manual if you don't know how to use the equipment. You will also need to consult your facility policy and protocol. You will need to perform hand hygiene before and after caring for your patient or handling any equipment. You will want to knock on the door. You will want to identify with 2 identifiers. You will also need to provide for privacy and explain the procedure to the patient. Elevate the bed for good body mechanic. You will need to note the overall health of your patient. Don the proper PPE, which they were using gloves. Then afterwards, you will need to report, record, and document any findings. If they are abnormal, you need to report them to the charge nurse. And then you will also need to lower the bed back to where it was at. You will give the patient the call light, and you will also need to put bed belts up if indicated. For both of these, you also need to adhere by the 6 medication administration rights, which include right medication, right document, your right route, right patient, your right time, and right dosage. For the first one, I'm going to do intramuscular injection. So I will knock on the door. I will perform hand hygiene.
Give consent to be recorded.
Now I will identify the patient using 2 identifiers. Can I get your name and date of birth, please?
Slade Culver, 11/1998.
Thank you. I will gather my proper equipment that I will need. And I will first look at the vial. I will look at the name. And I will compare it to my MAR sheet, which is right here. I'll make sure I have the right medication. And I will make sure that it is not expired. So I will take the cap off. Take an alcohol swab and clean the top of the vial. For this injection, we will be using a blunt needle to get the medication out of the vial. So I'll take and put the blunt tip on. The reason we have a blunt tip is so the needle does not get dull when you stab it or when you poke it into the vial. And you will want to pull the syringe out, make sure you get the right dosage you need. Insert the tip into the vial and inject the air. You will flip it upside down and get your medication. You will hold it at a 90-degree angle, eye level, and you want to make sure there are no air bubbles. If they are, you can tap them out. If you can't tap them out, you can insert the air back into the vial. Just make sure the medication does not go back in the vial as well. Take it out. Get all the air bubbles out. And make sure you have the right dosage. You want to use the scoop technique to place the cap back on. Take it off and put that in the Sharps container. Then you can go ahead and put the needle on. For this injection, there are 3 different sites. So for the trochanter site, ventral gluteal site, you want the patient lying in a supine position or lateral. For this demonstration, I will be having him on his side. If you use the left hip, you want to use your right hand. If you use the right hip, you want to use your left hand. So, you place your hand over the trochanter process. Your thumb point towards the groin, index finger towards the iliac spine, your middle finger toward the buttocks. In the middle of that triangle that your fingers form is where you want to inject the site. You also have the lateral aspect of the leg. You want to use this 2 thighs portion right here to inside it. And then for your deltoid, you want to find your acromial process. And then it's 3 to 4 finger lengths is where it would be at. Or you can find it in the little triangle. In the middle of the triangle is where that would be at as well. To clean the site, you want to take your alcohol swab and go from the middle all the way to the outside, at least 2 inches in a circular motion. You want to get your alcohol swab or your gauze, put it in your non-dominant hand. And for this, we are doing a Z-track method. You will not use the Z-track method if you are doing it in the deltoid. So I would take the cap off my needle. I would palm down, pull the skin. You want to do a 45 to 90 degree angle. Just go straight in. And you will want to aspirate 5 to 10 seconds to make sure there's no blood coming in. If there's not, you can slowly inject the medication, 1 milliliter every 10 seconds. You will also want to leave the needle in for about 5 to 10 seconds. When you pull out, you want to gently pull out straight. Engage the safety mechanism. Place your gauze and alcohol pad over. You want to apply gentle pressure. Do not massage it or apply too much pressure. Bandage if necessary. Then you will want to remove your gloves and perform hand hygiene. You will want to put that in the shots container before you take your gloves off and perform hand hygiene though. For the subcutaneous, you will also want to knock on the patient's door, perform your hand hygiene. Don the appropriate PPE, which are just gloves for today. And you also want to identify your patient with your identifiers. Can you get your name and date of birth, please?
Slade Cover, 11/1998.
Thank you. You will want to look at your vial and compare it to your Morse sheet and make sure the medication is correct and make sure that the vial is not expired. You want to take the lid off. Take your alcohol swab and you will want to clean the top of the vial off. Okay. Now with this injection, you do not have a blunt tip. The needle is already attached. So you want to take the needle off, go to your correct dosage that you need. You want to insert the needle into your vial and inject the air in. Turn your vial upside down and get the right amount of medication out. You want to keep this eye level as well and at a 90-degree angle. There's no air bubbles in this. If there weren't, you need to tap them out. And then you will use the scooping motion to recap it. There are also 3 sights for this one as well. You have the posterior aspect of your arm, which is the fatty portion back here. You have your front of the leg, the 2 fronts portion right here. And you also have your abdomen. You want to put your hand below the costal margins, above the iliac crest. Anything between here, as long as it's 2 inches away from your belly button, you should be good. If they are normal weight or not obese, you want to pinch the skin and tuck the needle at a 45 to 90 degree angle. If they are obese, you will still pinch the skin, but you want to insert at a 90 degree angle underneath the fold of the pinched skin. To clean this side, you want to start in the middle and go out at least 2 inches. You take your gauze or alcohol swab, put it between your fingers of your non-dominant hand. You will want to uncap the needle, pinch the skin, go at a 45 degree to 90 degree angle, and insert the medication slowly. After that, you'll put the alcohol swab or gauze over, engage the safety in your sharps container. Do not put any pressure on. If you do, just make sure it's real gentle. Do not massage the skin either. Apply bandage if necessary. You would take your gloves off and perform hand hygiene.